Hello, welcome to the SwineTime podcast here at Pipestone. I am your host, Spencer Weaning. I am one of the staff veterinarians here.
I'm also one of the owners in Pipestone Holdings, and when they let me do my regular job where I go out and work with farmers, but then they also let me do this real fun job where I get to interview people that have interesting things to say for our podcast. And today I have the pleasure of having Emily McDowell, one of our other veterinarians here at Pipestone, as my guest. And there's go-to people you have in your group that remind you of the right things and the details and things you can't keep in your brain. And she's the go-to person I would go to for E. coli information. So she's here to talk about E. coli, hemolytic E. coli, I think in particular, and the stuff we deal with in the nurseries. And I will shut up and just turn it over to her. Emily, why don't you tell us a little bit about yourself, and then we'll get into the topic.
Sure. My name is Emily McDowell. I've been with Pipestone about 11 years. I would be also one of those vets that just goes out in the barn, spends a lot of time out in the field working with farmers and producers. I actually live in Iowa, northwest Iowa, and so on an acreage there and enjoy it, and but able to spend time here at Pipestone and work with the farmers that I love. So yeah, I would say I have some experience with E. coli and have worked with them, have dealt with that concern for a while. So.
Okay. So just maybe start out with a review of when we say E. coli, and I said hemolytic E. coli, but what are we talking about as far as the bug and the disease that it presents?
Sure. Yeah, so hemolytic, there's lots of things that can cause looseness, and so E. coli is just one of those. So I'm going to step back a little bit more even, but there's, as far as the infectious concerns on the bacterial side, there's E. coli is a main one, salmonella, there's some other bacterials, there's viral causes too. Rotavirus would be one, PED or the coronavirus causes, and then there's some parasitic causes as well. So, but E. coli is in most pigs, but there's the hemolytic E. coli that particularly cause problems, and that's what we're going to talk about or focus on today. But I would say clinically, there's different kinds of E. coli. There's different fimbrial strains of E. coli. There's a KD8, which typically doesn't cause any major concerns, but then there's the F18 E. coli, which is the one that can lead to significant mortality concerns that we talk about, and one that we focus on the most, I would say. What we'll see typically with that, it's a nursery phase. You mentioned that earlier. Typically 7 to 30 days on feed is a very normal timing that we'll see this. It can lead to significant mortality. 3 to 15 or more percent wouldn't be uncommon. Would be a thing where you could have 1 or 2% a day even in certain cases, and it can be hard to control. So in an E. coli, typically you'll see looseness, but a lot of times sudden deaths, a lot of times pigs that just have sunken eyes because of some of the toxic concerns that can happen. So it presents a lot of different ways, but posting can really help to identify the cause and get us to a solution quickly.
Yeah, so I'm just thinking, so my experience being in barns and for the listeners to kind of frame up what we're talking about, everything you just said, some of the words get thrown around, F18 and KD8, real common. And the classic setting I would have, or a lot of folks would have, is like, oh, I've got this storm that looks like it hit where things were going fine, and then do I have strep? It's so acute, you think it's some brain disease. It looks like a neurologic problem sometimes, and it'll be pure water diarrhea, right?
Yep.
And then you open them up, and the intestines are either totally empty because they've already had diarrhea severely, or they're full of water. It looks almost like milk flowing out of their intestines. Just so much water gets sucked into the guts, out of the body.
Yep. And the neurologic part that you talked about, I mean, the pigs almost look like they're stargazing. They can be down, and they can kind of have their head back and look like they're stargazing, and so that's what makes it look like strep. And posting is what you need to do to identify, to get on the right path of what's next.
Yeah, so there's a total classic look to it. The sunken eyes, piles of them, just looked exactly like you see it every time. It looked the same.
Yep.
So why now? Why not as much 10 years ago? Because it has been a creeping concern for the past 10 years at least. It's gone up and up and up. Is there a reason for that, why we have more than we did, just a few years ago? What changed?
Yeah, I think the timing correlates really nicely to when the consumers and ultimately the packers really drove us to go to more of the Duroc-sired pig. And so some people say, why Duroc? Well, I think the Duroc themselves have a lot more receptors to E. coli, or they're a lot more susceptible to it because of those increased receptors. overall, I would say that's probably the biggest driving change. And I do think there'll be some changes over time. I think that'll get better. But the genetic companies have identified genes that can help with that, and it's going to take time to select for that. But I think when we went to the duroxide pig, it was a line in the sand for a lot of people, and definitely an increase that we saw.
Yeah, the price you pay for red.
Yes.
Whatever. So, okay, that's been a change that might drive towards it. And then beyond that, who knows? But we got more now, and then I'm thinking, are there things you can do to prevent it? Are there things you can do to treat it? And let's start with the prevention. I got stuff in my brain rattling around, but what would you lay out for how do you prevent this problem from happening? If you had a bad experience going forward with the next groups, what do you do?
Yeah, so I think there's so many things that are intertwined here when you talk about it, but just thinking of a list, I mean, there's definitely vaccinations that we can do. There's some antibiotic treatment protocols we can do, lots of things on the management side, nutritionally, on and on. So probably the easiest place to start is just vaccination is a really critical one that you need to start with. So two options really for vaccinations. There's an oral vaccination. It's called a receptor blocker. Or a competitive inhibitor. And so the basically with that, it's an oral vaccine that the pigs will take in the water, and it's a short time frame. It lasts 8 to 10 days typically, where it would block those receptors, but hopefully the good E. coli or the vaccine E. coli would attach those receptors and would hold those so that the bad E. coli's, quote, bad E. coli's can't bind.
Okay. So yeah, it's kind of like chairs at the dinner table, and you let somebody that wasn't going to hurt the pig sit at all the chairs, so that when the bad guys come along, there's no place for them to sit. It just blocks all the sites.
Yep, exactly.
A temporary effect. So it's not like a regular vaccine where you're really getting immunity. Maybe there is some immunity, but really you're just blocking the stuff.
That's right. Yep.
Okay, so then you mentioned another vaccine.
Some of the new things as far as E. coli vaccination technologies that have come out are an injectable option. And so there's one particular vaccine company has an SRP vaccine. I had to look it up what it stood for, but it's a siderophore receptor in poron, and basically it controls the iron transport into cells. And so this is an injectable option. It's new, and we've had some experience with it. We're working on fine tuning that and learning more with some of the PAR trials that we're doing. But overall, it's a vaccine that you have to give injections initially, probably at weaning.
To the pigs.
To the pig.
To differentiate, not the sows, not pre-farrow. This is to the pigs. Okay.
Yep. Give the vaccine to the pig, typically at weaning, and then we would do a booster shot to the pigs, typically roughly 2 weeks after that. And so the injectable strategy really is a strategy that isn't a good option for those that struggle with E. coli within the first week of weaning. It's more of a technology that where vaccine benefit is on pigs that would break in the 18, 20 to 30-day time period. So
okay.
Because of that, often we need to use both vaccinations, and if we have a concern and we're working through an issue in a nursery, we might have to use the oral receptor blocker vaccines in order to build up to that time where the injectable vaccines might actually be effective, for 2 weeks plus. So
I get this question regularly to me, and I think it might have some impact, but I don't know. What about all the stuff you do for farrowing crate scours? You do feedback to the sows. You give pre-farrow scour vaccine to the sows. You're managing that. Does that earlier scour when they're 5 days of age or 2 days of age relate to nursery scours? What's your thoughts on that?
Yeah, so I think, we overall, I would say that there's things that we can do to keep the gut healthy as best we can, but typically that type of scour isn't a big factor in what you would see later. But I think there are things that can contribute to more concerns later too, or more looseness. Salmonella might be one of those, or a coccidia scour might make some other gut issues worse later.
Okay, so tenuously related possibly.
Potentially, yes.
Okay, so we talked about immunity. Then I'm shifting my brain over to sanitation. What are the steps and where would you do them for sanitation to make sure the environment is not loaded up with the problem?
Yeah. So I think environmental load is the word that I use a lot. I would say we have to do a lot of things to reduce environmental load. One of those just basic things is all in, all out production. I think if we have the ability to clean out a barn, remove all the pigs, use a detergent when we wash, then use a disinfectant when we wash, and then finally make sure it's dry. So those things are very important. We've got different detergents that we can use, or soaps, and so when you think of, would you want to eat off of a plate that's not been, where you don't use soap to make sure it's clean, and then that detergent step really after the wash helps to make sure that that's even cleaner than what it was. So
okay, hey, on that, so that everybody's got a detergent or Dawn dish soap, and then everybody says, "Well, I got a disinfectant." Who knows? It might be Synergize, Vercont, something like that.
Yep.
Whitewash, at least in my view, has been something that's, I don't know if it's a game changer, but it sure seems to work better in many cases. Can you describe what a good detergent might be and what a good disinfectant might be, and then talk about whitewash?
Sure. Options for detergents, for sure. We have used Dawn dish soap in the past. We have used, there's an Atmosphere product that Pipestone has used for a long time. There's some other newer products that have more of a foaming ability to them. So they've been great. As far as detergents, there's definitely options there, from Synergize to Ag Forte again, bleach in some cases. And then I think if you really end up in a concern, then the whitewashing, like you mentioned, Spencer, is I think the best thing that we could do. I think it's ultimately the thing that I push people towards, and the thing it's easy to do. If you build the equipment, you can have it for any time that you would need. And I think it's the Cadillac program of any type of gut issue, whether it's salmonella or E. coli or whatever. So with that whitewash, typically it's a hydrated lime product that you would use, and you would add water to it. The pH would get very high. We talk about pH at 12. And you would set up a system with PVC pipes and garden hose and cheap little sprayer nozzles. And basically you would mix it up, and you would coat that with using a sump pump, pump it out of the container that you mixed it up in, and it would look like just a white kind of milk. It's thicker than milk. It's kind of a milky substance, though, that covers the crate, and then ultimately you need a day of downtime at least to make sure it's dry. So it can cause burns on people if it's wet and it contacts your skin because of the high pH. But if it's dry, it seems like no issues. And
yeah. You said pH of 12, so just people thinking back to their chemistry class days in high school, like 0 to 14, and 7's right where water is, and it's perfectly neutral. 12, it's like a pH of 2. It's the opposite end of that. It's extremely to the end. Yep. And so I've known people that have gotten scars from it, not from just touching it, but from it being wet with that material and then rubbing from an elastic sleeve or something just into their skin. It will burn through your layers of skin if you don't tend to it and wash it off.
You need to definitely take the appropriate precautions.
Yeah. Yep. And it's a hassle doing this versus just loading up the hydrofoamer or something, spraying on a disinfectant afterwards. This is a little more hassle, but I think you said it right. It's the Cadillac program as far as the best. It's going to be the most aggressive. Yep. Okay, so that's the room. What about the water lines? This is a pet peeve of mine, but how do you
I would say you're the
lines?
expert on the water lines, but
no, I know what I like to do. But what's your approach of inside the water lines, stuff you can't see or treat or wash from the outside?
So I think we need to do some testing probably. If you're a barn that has consistently have concerns, we have places that we can easily send water testing out to, and we can look for, is there E. coli from a well, or is there E. coli that's building up in a water line in your barn? So really trying to identify, is there a concern or not? And then if there is, where is the issue, so that we can work through it. And so I think that's number one. Some water sources have a lot of other elements in them. You think of sulfur, or you think of manganese, or other things, and so it's good to know those too, because some of those elements can also cause secretory diarrhea if in high amounts. So it helps, really helps to make sure that we know of what we're dealing with, and that if we can fix it or not, or if we need to come up with something more extreme, of even coming up with, do we need to put rural water in this barn if we have well water that's really bad, or what are some other options that might allow the pig to start on a better water source and then move them over to that other source. So, and then you get into water lines in the barn, and I think heavily overlooked for sure in most barns as far as, flushing those water lines or cleaning them. And so there's products that we can do in a short period of time where you can, pump water, pump something in there that can break them down and then flush it out. Or there's also products that we can do that you can actually run while the pigs are in the barn and are more of a slow acting dissolve of whatever's in the water line. So even simple things like making sure that we have flush valves on the end of a line in a wean to market barn or in a nursery that you can flush the water out, any stagnant water or water that just doesn't move as quickly. So before it gets to the water nipple.
Okay.
So
what I heard you just say there was, I think maybe well water is going to struggle more than rural water.
Yep.
Well water's got just more stuff in it.
Yep.
Second thing is there's bacteria there that you may want to figure out how to address. Treating it at the well, I'm thinking in my mind like shocking the well, putting something in to kill the bacteria, something to clean the water up. Everything from sand filters for cleaning the water up to RO systems, whatever. Taking care of the quality of the water, and then cleaning the lines is the last thing. And I know peroxide products work well for me, but there's other stuff. You just got to oxidize and get the scum out of the line so that there's just a surface of plastic, not like a fertile seed bed for bacteria to grow. You just got to get it out.
That's right.
Is that fair?
Yep, absolutely.
Okay, so water lines, room for prevention, sanitation prevention. Anything else? Anything on?
Oh, nutritional. So there's that. I would say on the nutritional side, we talk about adding fiber. Particularly steam-rolled oats can be a really good one, just to bulk up the bellies on those pigs and to help them have a more healthier gut from the time of weaning, if that's a concern. I would say we need to look at protein sources or timings of those phase changes. Soybean meal is one thing that can, in high amounts, can easily cause a scour. So. Or death loss. And so if, especially in those earlier phases, high amounts of soybean meal aren't very helpful. I would say typically we see concerns over phase changes. So, from phase 2 to phase 3 or from phase 3 to phase 4. And so if we can identify the timing that it happens, then we can go and ask our nutritionists, what can we do? And this is what we're typically seeing with timeline. So that's another one. Zinc oxide, adding that to the feed is, can also be really helpful, and there's probably many others, and I'm definitely not a nutritionist, so I shouldn't be.
Yeah, it's just funny
be careful. But
two veterinarians talking about nutrition topics like we know, but I think you're right. From what I've seen, fiber, the quality of the protein being fed, the zinc or copper levels that are in there, and how they're dropping down, and the timing of all that. Because the problem is an explosive issue at day 20. Well, that's right when we switched diets, or that's right when I stressed the pig somehow, or right when I dropped all the zinc out, or something like that. Looking at the timing of the problem and then relating it to those dietary things. For
sure. And then you talk about management too. So one very common strategy with E. coli, if you have E. coli, especially over phase changes, is to blend feed that comes in. So if you have, instead of running all of phase 2 into your, through the hopper and into the bins in your barns, maybe you open up part of the slide as you run the last part of phase 2 and the early part of phase 3 together, and you blend it as it runs into the barn. So that's an option. But try to avoid those drastic changes. With feed is one management practice that you can do as well.
Okay. This feed thing is making me think of something you might do management-wise, not for preventing, but for treating. So jump into that topic. I got a problem right now. I'm just noticing this thing it's like a train wreck happening right in front of me with pigs dying. What are the steps you can do? And I'm thinking one with feed and feeder management, but
sure.
Go through the list of stuff that you might have for treatment options.
Yep. So I think it's extremely important that we find, I talked about with F18 and E. coli in particular, I get calls all the time, or I've lost 1% or I lost 2% in a day. And why is that, or what happened? And so I think one really important piece is that you find it early, or that you find these pigs and you identify it early. And if we can, one strategy that works really well is what we call a feeder shutdown. So if it's in a barn, you could literally shut down all the feeders, and you get bags of steam-rolled oats, and you would scatter that over if there's mats there, or the mats, or you could even put it in the trays in the barn. And typically you would feed steam-rolled oats for 36 to 48 hours if you need to, and then you go back to your regular feed. So that would be a big one. I know of people that do just certain pens of that too. If they, they know what it looks like, they can catch it early, and they've been extremely successful with that.
It's all, in my mind, it's akin to I got a spark, a fire, like a smoldering fire that's about to start, and you just basically take the oxygen away from it.
Yep.
They got a pure coarse fiber is really what they got with the oats, and no other easily digestible carbohydrates to be like gasoline.
Right. Yep. You're taking the fire away. Absolutely.
Okay. And then, I'm holding the pigs back. Well, it's yes, for a day or a day and a half. It's better than having 5% mortality, and it does work pretty well, especially if it's been a patten in your barns. I would guess that you know what's coming, so you immediately take that action.
Yep.
Okay, feeder shut down fiber, rolled oats.
Yep.
Then classically, we're veterinarians. We say, well, we got an antibiotic for that, but what's the situation with E. coli and antibiotics?
Yeah.
Often, what do you do?
So, as far as antibiotics, we've got a few tools in our toolbox, but honestly, they're fairly limited. And so, typically E. coli's, and I would say would be true for salmonellas or other bugs, but they actually readily become resistant to the antibiotics that we do have in our toolbox. And so, and I think of, the main ones that we use, the GenGuards, the neomycins, Equisols even. I mean, those are very common to be resistant. So they're one strategy that we've used in some barns, if there's high death loss, is even injecting different antibiotics that would be appropriate into the pigs themselves. So
like a whole mass injection.
Whole mass injection, yep, is something that can happen. And then we've done some. Certainly, diagnostics can help us too, but we're not going to have results for diagnostics when we need them. We need to have a plan in place early. So
there's some go-to products that you might have on your short list.
Yep.
But like you said, it's resistant oftentimes, so nothing works.
Yep. And then I would say a tool that we haven't talked a lot about, but is a really big one for E. coli control, is acids, right? So we've done a lot with acidifying the water, and there's different products that we've used. You could talk about citric acid, or there's an Activate product that we've used more and more. And so even in the event of an E. coli outbreak, we've done some antibiotic things, but then we might follow it up with acids. And so our goal really is to get down to a pH of 4.0 with some of these acidifiers. And we've had some research, two years of vet interns, Carly Bates and now Rachel Rutterath this year, that have done a lot to help us fine tune, at least in a Petri dish, what does it look like to run acids, and what should we target is for the right target. And I think that was our kind of what our outcome was yesterday or last year, and then this year we fine tune it even more, and it doesn't really change our thoughts. So
on that topic, a few things. One is it really fits into prevention and treatment. So I got a problem. Well, acid could easily be part of your current treatment, but also prevention, getting that pH down.
Absolutely, yes.
And so I'm continually surprised by how low the pH could or should go, because if I went back 5 years ago, put some citric acid in. If you can get it down to 6, that's good. Mm-hmm. But we found that it's lower is better, and down to 4. And and I'm sure listeners are thinking, 4, doesn't that melt your face off? How are they even able to drink that? Well, what is Pepsi, like 3.5?
Yeah.
The pop we drink is mid 3s a lot of times.
Yes.
So it's not as acidic as the pop we drink while we're driving on the road. We wouldn't drink pop for every beverage of the day, but it's not unsafe. Mm-hmm. And if you can modulate,
it's not a forever plan by any means. It's a strategy to get us through to a time where E. coli's don't tend to be as devastating or as common. So Yep.
Okay. What else is that? We hit what E. coli is, prevention measures, treatment options. Yep. And we didn't spend a lot of time on antibiotics, but a lot of times there's comment on this, because sometimes a producer may come up and say, hey, we did this one thing in the water that the answer on our end is like, well, that's illegal. There's things that are not lawful to do that I think the listener should be aware of. Like, well, that was done sometimes, but it's not allowable by law now.
That's right.
And there's a few products you can't.
Yeah. So like the Batrils or Enroflox products it's not lawful to use those in the water. Any type of ceftiofur product, which Naxel would be the water, would be the one that would be used in this scenario, and that would also be illegal. So puts to your veterinarian, or your veterinarian's license is on the line. And so it's our obligation to say that that's not lawful.
Okay. And then there's other options that aren't standard swine drugs too that might be part of the discussion, but you're to a very short list of options at that point.
Yep.
Any feed drugs that you think are worth commenting on that might be helpful?
Yeah, so I think, this is, again, on the preventative side, I would say Mecadox in the feed is one that would be an option or would be able to be used. And would be part of a health plan on the next group of pigs coming in. There are some other ones. Cavalt in the feed is another option. An older one, Neoterra is an option also that I've used on occasion. So,
any of those end up being home runs, or is it? What's your experience been with feed meds for scour help?
I would say no home run by any means, but it's part of the big picture of what we can do to help in this situation. So,
okay.
Yep. I think a couple other management things, just keeping the pigs grazing, on the preventative side is important. If the pig is off feed or if it runs out of feed or all those things, we just need to keep the pig eating. I think environmental load, some of that also, we talk about ventilation, and is the floor dry? Is the environment dry? Is the pig comfortable, or is it piling and cold, right? So all those things would be factors also, I would say, that would lead us to more concerns.
Yeah. You hit a good one there with the pigs piled and cold. If air is coming into weird spots of the barn, especially from underneath or at the pig level, turbulent, making them uncomfortable, just start the clock. 12 hours later, they'll be scouring.
Yep.
Okay. All right. Well, we beat that one up pretty good. There's probably stuff we didn't talk about, but we covered a lot of stuff.
Yep.
And can't think of anything else we need to cover?
No, I just think definitely work with your veterinarian, definitely work with a nutritionist on both the prevention side and the treatment side and what we can do. And then we need to think about the next group of pigs and come up with a health plan. And certainly sometimes we need to do diagnostics to make sure that we're on the right page. And, the thing I want to avoid is group after group after group where you're struggling with the same thing. I think both yourself and your veterinarian and nutritionist are going to be extremely frustrated.
Yeah, especially when you say, well, we're going to use this antibiotic because of what you said. It maybe worked this time. It might not work the next time, and pretty soon you're left with no options. And so you better be thinking very holistically about a lot of other things.
Yep. And I think if you're struggling with some gut concerns, every time it seems like we add more things, and eventually it we want to be able to try to nip it in the bud versus eventually have concerns because I've used so many antibiotics over time, and now I've had resistance, and now I'm seeing concerns because it doesn't work anymore. So. Okay.
All right. Emily, thank you for being here. Thanks to our listeners for listening. If you have any questions about this, Emily's available by phone. You can find her number somewhere on our webpage if you want to talk to her directly, or you can call anybody here at the Pipestone Vet Clinic if you want to talk further.
Yep.
And tune in next time to our next episode, our next guest with the SwineTime podcast here at Pipestone. The SwineTime podcast was created for the pork industry and individual pork producers around the country. Hosted by me, Dr. Spencer Wayne with Pipestone Veterinary Services, the podcast contains pork industry news, advancements in animal care, and how to enhance your productivity. Find the SwineTime podcast at www.pipestone.com or on your favorite listening platform.